Did you know that according to the Joint Commission Center for Transforming Health in 2016, tens of thousands of patients fall in healthcare facilities every year, and many of these falls result in moderate to severe injuries, and that each of these injuries on average adds about 6.3 days to their hospital stay at a cost of about $14,000. That's a whopping 30% of patients that will fall in the hospital each year. Research suggests that hospitals that implement intentional hourly rounding by nursing staff show a decrease in the number of patient falls and an increase in overall patient satisfaction and scores. In this speech, I will cover two main points. The first, that implementing intentional hourly rounding improves patient outcomes because it helps to decrease the number of patient falls. And second, how intentional hourly rounding increases patient satisfaction scores. My first point is hourly rounding decreases the number of patient falls. So what constitutes a fall? According to the Joint Commission, a patient fall is a sudden unintentional descent that results in the patient coming to rest on the floor or another surface with or without injury. Darlene Hicks is an RN MSN nurse educator from North Carolina who did a lot of research on this topic. She discusses how patient falls are a leading cause of non-fatal injuries and trauma-related hospitalizations in the U.S. And this has been linked directly with the quality of nursing care in the hospital setting. According to the Joint Commission, falls have been identified as an event that is preventable and should never happen. They also tell us that falls, the Joint Commission, that falls is on a list of hospital-acquired conditions for which reimbursement will be limited if a patient falls while they're in the hospital. So they won't get paid. So what are hospitals doing about this? Darlene Hicks tells us that the Joint Commission has identified reduction of harm from patient falls as a national patient safety goal, and that providers and accredited hospitals are required to assess all patients so that fall prevention measures can be implemented. For instance, a patient who has had anesthesia and is just out of surgery has a much higher risk of falling than one who has just delivered a child naturally. According to Quigley and White in 2013, nurses make a major contribution to patient safety by assessing the fall risk and designing patient-specific interventions to help reduce the risk. One of those main inventions is intentional hourly rounding. So what exactly is it? According to Hicks, the process of intentionally checking on patients at regular intervals to meet their needs proactively. In other words, not waiting for the call bell to ring. The intentional part has to do with using the 4 P's: pain, potty, positioning, and possessions. So every hour, 2 hours at night, you would go in and ask the patient if they have pain, if they need to use the bathroom. Are you comfortable? And do you have everything you need in reach? Your eyeglasses, your cell phone. And we tell the patient then that we'll be back in 1 hour. Timothy, 2016, he looked at a lot of research, and especially from Darlene Hicks's research that shows 52% reduction of patient falls when hourly rounding is done, and that it is indeed an evidence-based nursing practice. Hicks performed a 6-week national study on data from 27 nursing units in 14 hospitals where the nursing staff used the 4 Ps. Baseline was taking at the first 2 weeks, and it was analyzed and summarized, and they came to find that a decrease in patient falls was significant, which brings me to my visual aid here. I took these 4 data from these 4 hospitals from Hicks' study and looked at the before and after numbers per patient 1,000 days. and each one had a significant, as you can see, before and after the falls, especially number 4 went from 7.2 falls to 3.18. So it shows hourly rounding does in fact decrease patient falls. Which brings me to my next point, that patient safety is not the only reason intentional hourly rounding is a benefit. Research tells us that intentional hourly rounding increases patient satisfaction scores. Mitchell and others in 2014 states that it's a key metric that influences both hospital ratings and reimbursement, meaning a happy patient who feels cared for is going to, tell their friends. And hospital depends on these good ratings for reimbursement. Mitchell also talks about HCAHPS, which is the survey that Medicare uses to figure out the levels of reimbursements. They have questionnaires that ask the patients, how often did you press the call button and did the nurse come? Fast. If the satisfaction numbers are low, hospitals do not get paid for that as much. Mitchell goes on to say that nursing responsiveness is an important factor in all of this. A patient who feels assured that their nurse will be back when she says she was will feel trust in the nursing staff. Mead and others talk about saying that by taking the initiative to address the basic needs, potty positioning, pain, and proximity, in a structured format, a nurse can decrease patient anxiety and minimize uncertainty. Hicks agrees that, it has a secondary benefit of decreasing patient anxiety and increasing patients' perception of staff attentiveness due to their increased presence, in the room. In other words, when a patient knows that someone will be there every hour, they don't feel helpless. They don't have to worry about wetting the bed, and they're just more comfortable in general. So, which brings me to my conclusion that research shows that hospitals can decrease the number of patient falls and improve patient satisfaction scores by implementing intentional hourly rounding, and that hourly rounding helps to decrease patient falls and increase patient satisfaction. Intentional hourly rounding uses the 4 Ps by hospital nursing staff to effectively used as a tool to keep patients safe by preventing unnecessary injury or death while the patient is hospitalized. Intentional rounding increases patient satisfaction and trust with the hospital nursing staff, which in turn promotes better patient outcomes. Thank you.